Hello, economics students. Today we're going to be covering the Unit 1 activity. I believe it's called, Introduction to Economics. It's the Unit 1. So if you're there, go ahead and open that up and we'll go ahead and get started. I'm going to present my screen. And the activity should look like this. So you see Unit Introduction to Economics. You can kind of skip through all this. There's an introduction. Feel free to read it. I'm not going to. Okay. Let me increase the size of this. Okay. Maybe that's a little too big. There we go. Okay. The U.S. healthcare system is unique among healthcare systems in the world in terms of innovation and access to and payment for care. To begin your comparison, read this short article comparing the US and UK healthcare systems using information from the article to complete the chart. So you can click on this link and that'll take you to this article, YouGov America. And it basically talks about socialized healthcare comparing British and American attitudes. So open up that link. You're going to need to reference it in a couple situations in this activity. And I suggest you read the whole thing, but I'll be covering certain parts that are going to be part of answering certain questions that'll help you out a lot. Okay, so let's go ahead and look at this. To begin your comparison, all right, let's take a look. Doctors paid by. So we have the US system and the UK system. And then led or run by, positive aspects for both systems. So here they want 2 positive aspects for the US system, 2 positive aspects for the UK system, and then negative aspects as well, 2 for each. So for doctors paid by, well, in the US system, generally speaking, the doctors are paid by insurance and basically customers, or in other words, patients. In case of healthcare system. Now in the UK, they have a socialized medical system. So in other words, the taxpayers are essentially what pay the doctors. So we could say the government / taxes. And hopefully you're aware the way the US healthcare system works, but basically if you have insurance, your insurance pays for your health, for any health costs that you have. Otherwise, the patient has to pay for them out of pocket. In the UK system, basically everyone pays into the system, so everyone pays taxes, and then the government takes those taxes and uses them to provide healthcare for everyone of the citizens. So in the case of led or run by, I kind of just explained it right now. In the case of the US system, it's led or run by the private sector. Or in other words, the markets. The markets take care of pricings and things like that. The UK system, again, it's the government. And the system that they use, and I'm going to reference it a lot, is called the, the NHS. The NHS is the name of their system, and that's the National Health Service in the case of the UK. So the government, and the name of this part of the government is the NHS system. Okay, so what are some positive aspects? So we kind of talked about some positive aspects of some of these, but for the UK system, the main positive aspect is that everyone has coverage. Okay, everyone has coverage. Now, we can kind of say that that's kind of a negative aspect of the US, is that not everyone has coverage. Not everyone has coverage. You have to purchase health insurance in order to get coverage. So in the US system, generally you get coverage from insurance, and usually your employer will pay for a large portion of that health insurance coverage if you have an employer. Okay. And then for positives and negative aspects, you can go down to this section. So it talks about some of the things that the U.S. is favorable, the U.S. system. So when you're looking at this article, you can go down to this system according to the U.S. participants. Talks about some positive things: excellent care, modern technology, shorter waiting time. So these are positive aspects. You can write those in. As far as for negative stuff, poor citizens usually don't have insurance, sadly. Also, it's very expensive in a lot of ways. And sometimes it's hard to deal with insurance companies. Now, some benefits for the British, how universal it is. Basically, everyone gets the insurance. And some negative aspects is that there's longer wait times, lower quality of patient care, and usually worse technology and things like that. And overly bureaucratic system. Okay. So see if you could fill out the rest of this. So we talked about some of the positive aspects, some of the positive aspects of these, some of the negative aspects. And again, you can find those things in this part of the article and list those there. Okay. All right, let's move on. Question 2. So once you've answered that one, let's move on to question 2. You can pause the video and finish answering question 1 there. Question 2. Now fill the gaps in your knowledge of the US and UK healthcare systems. Think of something you would like to know about the two systems. Compose a research question about the topic, and then answer that question. Answer the questions below. What is your first research question? So a research question, something that we can think about is how much do the citizens pay for healthcare? Question mark. So what you would want to do is think about for US citizens, you have to think about, well, how much do you pay for your insurance? Plus how much do you pay for co-pays? Plus how much do people pay if they don't have insurance at all? So these are all things that you have to think about. For the UK, they don't pay for any of their medical treatments, but instead they pay for it all in taxes. So they're still paying for it, but just in the form of taxes. So we want to see how much do the citizens pay for healthcare in each the US and the UK. Okay. So now search the internet to find those answers to your research questions. What is the answer to your research question? So for the US, I looked up, right here. The US healthcare, I just looked up on Google. How much do Americans spend on healthcare? US healthcare spending grew 9.7% in 2020, reaching $4.1 trillion. Or in other words, $12,530 per person. So this is more the answer we're looking for. Okay. So here that talks about in the US, each person spends $12,530 on healthcare. And this is also important, the gross domestic product, or what portion of the gross domestic product is spent on healthcare. And you can see 19.7% of the nation's GDP is on healthcare. Okay. This is actually a huge amount of money, Think about it. Each person in the US is spending on average $12,530 on healthcare. Now, if you're healthy and young and you don't visit the doctor that much, the amount you spend is probably much lower than that, but you never know what might happen. You might be have an accident. You have to be rushed to the hospital in an emergency. Or even when people get old, they get sick, they have to live in the hospital, they end up spending a lot more than that. So for every person that spends less than that, there are some people that spend more than that. Hopefully you have insurance. Okay, so that's part of the answer. So that's for the US. For the UK, you could see that for the average person last year, I see right here, this is actually for 2019, so I don't have 2020's numbers. But you can see 2,647 pounds per person. Okay, so I know it's not dollars, these are pounds, but actually that's much, much lower per person. So on average, the UK, they spend much less on healthcare than the US do. Okay. And again, this would be taken out of their taxes. They wouldn't be paying this directly to doctors or hospitals or anything like that. Okay. So those are the answers for this question here. Now, if you chose a different research question, you'd have different answers here. Okay. On which website did you find those answers? So you can go ahead and look at these two links. Here, we use this National Health Accounts historical, www.cms.gov. And in this one, it's health.org.uk. Okay. So those are the two websites you want to provide there. Okay. Look carefully at the author of the websites. What bias does the author or source have? Does this bias favor one system or the other? Why or why not? So one thing I want to point out is that these are both gov, right? This one's .gov and this one's .org.uk. So it's unlikely to have strong biases because a lot of these government-run websites, they need to be very accurate. So it's unlikely to have a strong bias towards one way or the other because these are government-run websites. So you can say something like that here. Okay, let's move on. Okay, so once you're done answering that, let's move on to question 3. Now think of something else you would like to know about the two healthcare systems. Compose a new research question about the topic and then answer the questions below. Was the source you found for the first research question US-based or UK-based? Try to find a source from the other country for the answer to your second research question. Okay, so we kind of used one from US and one from UK in the last question. So here we're just going to use one from the US. But for our second research question, one thing we could ask is, how do people feel? How do people from the US and UK feel about their health system? So how do people feel about it? Are they satisfied with their healthcare system, or would they like to see it changed? The reason why we're asking this question is simply because we actually already have an article that talks about this, and that's right here. This government YouGov America article that we had before talks about that very thing. So you notice U.S. respondents, how favorable or unfavorable do you see about the U.S. and British systems of healthcare? So here for U.S. citizens, you could see U.S. citizens, 34% are favorable. They see the healthcare system as favorable. 57% see it as not favorable, and 9% don't know. Okay. And for the UK, you see it's different, but and you can actually scroll all the way down and you could see people's opinions down here. So these privatized healthcare is more efficient. So this is like saying the US healthcare system is good. So these are people who responded to that. So, and you could see where they're from. So this person, patients can take responsibility for their own healthcare and are not treated like children by the state. This person was from the UK. So this is someone from the UK talking about how he feels about the American system. Here's a person talking about the US system from the US, and this person is from the US, right? What about people who see it as unfair? So these are people whose opinions say the US system is unfair, and you could see their opinions here. For example, this person from Ohio says only the rich and the poor have healthcare in the US. Everyone else has to pay deductibles and co-pays and therefore cannot afford to go to the doctor or dentist. Okay, so that's this person's opinion. So what were the answers to the research questions? You can talk about these numbers given right here. And you could also cite some of these people's opinions. Make sure to say where you got these things from. If you're taking direct quotes from someone, make sure to see how they put their name, and also you would put where the website is. Okay, so make sure to cite that as well. But you can answer this question using these numbers and these opinions down here. Which website did you find the answer? Provide the link. So again, this is that same one we have, and you could just copy and paste this link and put it in there. Look carefully at the author of the website. Is it possible the author or source has a bias favoring one system over the other? Why or why not? Well, since this is YouGov America, they might have a bias towards the favorable, looking upon favorably on the U.S. system. Notice it's YouGov America. So there is a possibility of bias in this case. And so you might want to mention that there may be some bias towards the U.S. system. In other words, the privatized system of healthcare. Now shift your focus on two healthcare systems to economic terms. Okay, so what resources are scarce? So when it comes to healthcare, what resources are scarce? Well, let's talk about that word scarce or scarcity. Basically, it means that not everyone can get everything. There's only a certain amount of stuff or resources to spread amongst everyone. So what types of resources are scarce? Things like hospital facilities. And we saw that with especially the COVID pandemic. We saw some hospitals getting completely overrun or getting all their beds full, right? So hospital facilities, healthcare workers. There's not an infinite supply of healthcare workers, right? There's not an infinite supply of doctors and nurses and staff for hospitals, right? So these are some things that are scarce. We also saw other resources were scarce, right? What were some of the things that were scarce during the pandemic, right? Masks during one time, ventilators, beds, right? Medicine, and also testing, right? Testing for things, right? Remember, like COVID tests, vaccines or medicines might be scarce. So these are all things that we can put down as scarce resources for healthcare systems. Okay, we should probably answer this complete sentence. So maybe we could put some of the resources that may be scarce are, put a colon, and we'll put comma here. And then I want you to go ahead and continue this list. So I gave you some things that you could write here and just continue this list with anything you could think of that are scarcities in the healthcare system. In the US, in the UK system, who or what allocates the resources? So again, we already kind of talked about this, but the government allocates the resources. Through the NHS, right? Yeah. So in the US, that's not the case. In the US system, who or what allocates these resources? So again, this is the markets or the private sector. This is why in the US, if you're wealthy, you can get the best healthcare that anywhere can be found in the world. You can get the absolute best healthcare in the world in the US if you're wealthy or you have insurance. So that's one of the big benefits that people look at is if you have the money or the insurance, then the US healthcare system, honestly, you'll get better healthcare than most other places. And it's usually very fast. Unfortunately, it's also very, very expensive. As we saw, we're spending over $12,000 per person for healthcare. Okay. Classify the healthcare system in the UK. Is it market-based or command-based? So again, market-based is what the US has. That's the private sector. Command-based is what the UK has because it's controlled by the government. So I want you to briefly explain that there. And again, I've talked about it throughout this lesson that the UK system is command-based because it is controlled and regulated by the government. What about for the US? Classify the healthcare system. Is it market-based or command-based? So again, the US system is market-based, and it's influenced by market forces and the insurance companies. Okay. So once you've answered all that, then you're basically ready for question 5. Now, the better you answered all the other stuff, the better you'll understand and be able to do question 5 here, because question 5 is an essay that basically goes over all the things that we just went over. So question 5, compose an essay that argues which healthcare system is better in terms of economics. Analyze the reasons for determination by covering these points. Scarcity and allocation of resources. So that's what we just talked about, right? Incentives, role of the government, how prices are determined, benefits and drawbacks for consumers, benefits and drawbacks for producers, and be sure to include specific references to your sources and a counter argument. Your essay should include an introduction, transitions, and conclusion. So the one thing I do want to point out is those websites that we had before, feel free to, you should use these websites and any other websites you find to help you write your essay. Also, all the stuff we've written before can all be included in your essay. So you can think of this as you could do a 5-paragraph essay and just do 3 of those paragraphs on 3 of these things, right? You could talk about the role of the government. This could be a full paragraph, right? Maybe connect the role in the government and how prices are determined. You can connect these maybe into 1 paragraph, okay? And again, we talked about those things already throughout this lesson. The benefits and drawbacks for consumers, again, that could be a full paragraph, okay? And you want to do a counter argument. So let's say your essay is about, you want to show that the US system is better. Then you want at least 1 paragraph where you talk about some of the benefits of the UK system and then briefly explain why those benefits don't outweigh the costs of that system. Okay. And if you're arguing that the UK system is better, then just vice versa, right? Well, I'm going to let you try to do the essay on your own. But if you have any questions, you could always ask your teacher, and you could always email me or put in the comments anything that you have a question about. Okay. And I'll try to answer what I can. All right. Well, with that, hope you guys hope that made sense. Hope you guys understood that. And with that, I'll see you guys next time. Take care.